Good day, everyone. I say greetings to all the attendants in Somalia. I'm using this opportunity to welcome everyone and for giving me this opportunity to be part of the presenters of the second Somalia One Health Conference with a theme empowering One Health workforce to drive positive change for Somalia and the world in particular. So I'll be taking my presentations quickly because of the time allocated to me. So I'll be talking on the prevalence and public health importance of bovine tuberculosis in Gboko, Benue State, Nigeria, January 2023. My name is Dr. Karim Adetula. I'm a doctor of veterinary medicine, by profession, a livestock veterinarian practicing in Nigeria. And I'm also working currently as a field research assistant for a professor in Pennsylvania State University, working on the zoonotic risk factors of monkeypox in southern Nigeria. So briefly, bovine tuberculosis, a lot of us might know it's a zoonotic disease of public health importance, especially in developing countries such as Nigeria, from the family Mycobacteriaceae, and causative organism is Mycobacterium bovis, which is also from the same family of the human type tuberculosis, that's Mycobacterium tuberculosis. So, and in developing countries such as Nigeria, control measures are widely not applied, which have negative impacts on both the public health and the livestock industry. So the disease is widespread, is zoonotic, because not only can it cause disease in animals, but it could also be transmitted and either cause disease also as well as a latent infection in humans. So when I mean latent infections, what I mean is that the animals will be infected, but symptoms would not be obvious in such patients. So the disease usually occurs in poorly, it's widespread, like I mentioned, it's zoonotic, it's poorly controlled in Africa and poses serious threat to public health in Africa. There have been numerous reports of this zoonotic disease in different parts of Nigeria, in Africa. I think I was reading also, even in some developed countries in the world, there was this recent report of, I think, over 6% prevalence in England. You know, that tells us how serious the disease is, you know, but fortunately people have shifted attention to concerns in Lassa fever and the likes, and there are not so much attention on bovine tuberculosis. So to date, there is dearth of information on the prevalence of bovine tuberculosis in Gboko abattoir. You know, that's more or less the only place where cattle is being slaughtered in Gboko local government area of Benue State, which is the north central part of Nigeria. So, you know, because of limited information about the prevalence there, you know, that was what prompted me to, you know, push the study, you know, to report the prevalence of tuberculosis lesions through detection of lesions in tissues and organs of slaughtered cattle in Gboko, Benue State. So the study was carried out at the abattoir, which is the only abattoir in the local government area where about 25 to 35 cattle are being slaughtered, and evidence of pathological cases of tuberculosis in the viscera were based on postmortem examination of characteristic lesions during meat inspection. And data on breed, sex, and body condition score of each animal were documented on a daily basis by licensed veterinarian. So at the end of the study, a total of 1,042 cattle heads were slaughtered at the abattoir. 36 animals had lesions suggestive of bovine tuberculosis, which gave a prevalence of 3.45% per 1,042 cattle. So the prevalence of the tuberculosis was found to be higher in females than in males, and a larger percentage of these tubercles were disseminated in the lungs, followed by the liver, and there were no tubercles observed in the heart and other organs as well. So the majority of the slaughtered cattle were white Fulani breeds. Majority of them, we had the highest prevalence, but no tuberculous lesion was seen in Sokoto Gudali and Red Bororo, which were the other cattle breeds slaughtered at the abattoir. So also an analysis of variance tests revealed that the prevalence was not significantly different for the breed, the sex, and also the body score. So this was a table at the end of the study, table documented, showed the number of cattle slaughtered, the number of examined cattle. Seen white Fulani had the highest, with the highest birds, the highest cattle slaughtered, followed by Sokoto Budali and Red Bororo. There was, in terms of sex, the females were the most slaughtered out of the sex, and then the larger percentage of the cattle slaughtered there were more emaciated than moderate. So we can see also that the white Fulani were the only breed of cattle infected with suspected tuberculosis lesions, having a prevalence of 3.6%. And also from the body condition score, the cattle that showed a lot of emaciation, which had body condition scores of 2 and more of 2 and 1, were the ones infected with the high prevalence as well. So the second table showed that the lungs had the highest frequency of tuberculosis lesions, followed by the liver, and there were no tuberculosis lesions found on the heart and also on the kidneys. So in Nigeria, as well as other low middle income countries, the nationwide adoption of a test and call strategy may be an impractical approach. It might be difficult due to issues of high cost of calling, because it's very, very difficult to compensate for birds, for cattle most of the time. That is why it's usually difficult to test and call. However, vaccination of herds would play a role in the control of bovine tuberculosis, in Nigeria and also in Africa. It's very, very important. If it's difficult to test and call, we can just vaccinate a lot of them to improve on the immunity of the herds. So, and there is also need for government to employ qualified, competent personnel, most veterinarians in particular, to implement meat inspection measures, and also equip them with functional facilities for them to be able to test cattle that are being slaughtered, so that we don't have continuous influx, of continuous prevalence of tuberculosis, because there is poor control, there's poor control of this cattle during slaughter process. So there is need for them to implement meat inspection measures and also equip them with functional facilities for effective diagnosis during meat inspection exercises. So once we do that, we have a better record of the prevalence of tuberculosis in all states of the Federation and also in other countries in Africa, so that will give us or allow us plan better for better control of bovine tuberculosis in Africa. Thank you very, very much. And this is where I would end my presentation. Thank you.